People in India can get vaccine 24/7. News detail. In a bid to increase the pace of COVID-19 vaccination in the country, Union Health Minister Harshvardhan said henceforth people can get vaccinated round the clock according to their convenience. Prior to this, the coronavirus jabs were being administered from 9 a.m. to 5 p.m. However, taking to Twitter on Wednesday, Vardhan said that centre had decided to lift the time restriction, adding that hospitals can choose to administer the vaccines even after 5 p.m. The second phase of the COVID-19 vaccination drive is currently underway in the country, which began on Monday. People aged 60 years and more and those above 45 who suffer from comorbidities were included in the vaccination drive on March 1st. The second phase of the vaccination drive aims to cover almost 10 crore people. Prior to this, the centre had vaccinated healthcare and frontline workers. The government has lifted the time restriction to increase the speed of vaccination. People can now get vaccinated 24/7 according to their convenience. Prime Minister Narendra Modi understands the value of health as well as the time of the citizens, Vardhan tweeted in Hindi. The centre on Tuesday decided to allow even private hospitals not affiliated to Ayushman Bharat and state schemes to be included as centres for administering the inoculations. Union Health Secretary Rajesh Bhushan told a press conference on Tuesday that the timeline of vaccinating the beneficiaries from 9 a.m. to 5 p.m. has been done away with and is up to the hospitals to decide whether they want to continue administering the vaccines even after that. COVID 2 does not provide 9 a.m. to 5 p.m. vaccination sessions. It has done away with that timeline. If a hospital has the capacity, the system permits it to do vaccination even after 5 p.m. in consultation with the state government. This has been briefed both to the state governments as well as the private and government hospitals. The centre said 60 distribution points for the vaccines had been arranged nationally from where they are further distributed. The centre has also advised states to optimally utilize the capacities of private hospitals and ensure adequate allocation of vaccines to all hospitals, that is government or private, for which sessions have been planned. The second dose of the vaccine against COVID-19 was administered from February 13 for those who had completed 28 days since the receipt of the first dose. The vaccination of frontline workers started on February 2nd. More than 1.56 crore vaccine doses were administered in the country through 3,12,188 sessions according to a report. The beneficiaries include 67,42,187 health workers who received the first dose, 27,13,144 healthcare workers receiving the second dose, and around 57 lakhs health workers and beneficiaries aged more than 45 years with specific comorbidities and beneficiaries aged above 60 years. News Desk, Karma News.